Sachar describes the ulnar collateral ligament as part of a fibrocartilaginous complex which has numerous structures. It's said to have 4 attachment points, which include the deep dorsal limb and deep palmar limb, which form the foveal attachment, and the superficial dorsal limb and superficial palmar limb, which form the styloid attachment. The ligament involved in the complex include the palmar radial ulnar ligament, the dorsal radial ulnar ligament, the meniscal homolog, the ulnar collateral ligament, and the subsheath of the extensor carpi radialis tendon. The ulnar collateral ligament is further described as a poorly defined capsular structure which arises from the base of the ulnar styloid. Wrist sprains are often caused by a fall on an outstretched arm, a direct impact or twisting of the wrist with either flexion or extension, according to Barr et al. Therefore, the common mechanism of an ulnar collateral ligament sprain is caused by the direct impact and extension or ulnar deviation caused by the mechanics of a punch. Hand and wrist injuries are the most common injury found to occur in an 8-year period amongst 8 boxers in the GB boxing squad. In this study by Loosemore, wrist sprains made up 13.5% of injuries in elite boxing. Barr et al. Explains grade 1 injuries present with local tenderness and no instability with only structural damage. Grade 2 sprains present as partial ruptures with inflammation and is notably tender, however, doesn't cause significant change in instability. And grade 3s are a complete rupture of the ligament that causes significant swelling and instability. According to Dubin et al., the acute inflammatory phase is the first 24 to 72 hours following an injury. This stage aims to limit inflammation, reduce pain, accentuate the normal healing process, and protect the ligament from further injury. Acute rehabilitation focuses on offloading the injured wrist and incorporating some easy range of movement exercises. This is achieved using the Price protocol from the onset of injury, followed by therapeutic drugs, passive and active flexibility exercises, electrotherapy, and isometric strengthening exercises. In aid of the athlete's future training, some cardiovascular fitness and a stability program will be used to maintain or progress any uninjured muscle groups throughout the rehabilitation. It's also advised during this stage of rehabilitation to not use any heat therapy on the injury, refrain from alcohol consumption, and not to use massage on the injured area, as this could increase pain and swelling. For protection, according to Khan and Zhu, wrist braces can help reduce biomechanical overload on the wrist extensors, as well as increase pain-free grip strength. A wrist extension splint is seen to provide good pain relief and recommended for wrist sprains. According to the NHS website, rest is achieved by avoiding exercise and reducing daily activity, and using a sling for upper extremity injuries. Mei Lang, Yang and Stark suggest 20 minutes of icing every 2 hours from the onset of injury. As seen above, an ice pack can be placed over the injured side of the wrist to achieve this. Also, a tea towel can be used to prevent ice burns. In a study by Boehm Rayong et al., wrist compression taping, as well as other modalities of physical therapy, decrease wrist pain and significantly improve strength. Here, a figure of 8 compression taping is used to support the medial wrist where the ulnar collateral ligament lies. Bachman et al. Concludes elevation is the most appropriate treatment protocol to minimize edema in rehabilitation, as it lowers the pressure in local blood vessels and helps limit the bleeding. This should be done as often as possible throughout the day and can be achieved using a sling. Isometrics are often used as the first form of strengthening exercise in rehabilitation, especially when the region is particularly painful or immobilized, according to Bruckner and Kahn. By activating the muscle with it staying at the same length, the client's force matches the therapist's. Each exercise should be held for 5 seconds for 5 repetitions. Our first exercise here shows extension, and then we have flexion, supination and pronation, ulnar deviation and radial deviation. Baker explains that maximal aerobic speed is a critical factor for improving aerobic power. They also support the use of high-intensity intervals of 15 to 30 seconds intercepted with 10 to 30 seconds of low-intensity or passive rest, continued accordingly for 5 to 10 minutes for 2 or more sets. This is seen to significantly enhance aerobic power and capacity. They also explain that work to rest ratio is less important as long as the training done is above 100% maximal aerobic speed. During the acute phase, the client should start with 15 seconds of work to 30 seconds of rest at 80 to 90% of their maximal aerobic speed. For the intermediate phase, it should be progressed for 20 seconds work and 25 seconds rest, with between 90 and 100% of their maximum. In the late stage, they can use 25 seconds of work to 20 seconds rest at 100% of their maximum, and then during pre-discharge phase they should use 15 to 20 seconds work for 10 to 15 seconds of rest at 100% or more of their maximum. One way of calculating maximal aerobic speed is by calculating the speed an athlete reaches at the last stage of a Montreal track running test. The link shown shows Live Lean TV daily exercises example of a HIIT sprint training session on a treadmill. Dubin et al. Explains the next 3 to 5 days is known as the intermediate stage of rehabilitation, where collagen production intensifies in days 10 to 14. The goals include reducing inflammation, facilitating the ligament healing process, restoring active and passive ranges of motion, minimizing loss of strength, maintaining cardiovascular fitness, and beginning proprioceptive rehabilitation. Therefore, in this stage, focus is on partial use and weight bearing to full weight bearing progressions. This can be achieved by using myofascial release, electrotherapy, concentric and eccentric strengthening exercises with proprioception, as well as strength and cardiovascular training for uninjured muscle groups and partial weight bearing to full weight bearing on the injured wrist. Smith et al. Used a strength training exercise program to increase muscular development and improve neuromuscular control and increase in sensory activity which occurs following muscle contractions. This can be achieved using concentric and eccentric muscle contractions. 15 to 20 repetitions should be aimed for 3 sets of each muscle contraction if no symptoms are reproduced and there is not too much fatigue. The therapist will be applying force into the range of motion with the client resisting against the lengthening of the muscles for concentrics. Here we have flexion, extension, radial deviation, Ulnar deviation, supination and pronation. For eccentrics, the therapist will be resisting the client into the range of motion, shortening the muscle. Here we have flexion and extension, radial deviation, ulnar deviation, supination and pronation. According to Hincapie, Elkins and Zesquesh Welsh, proprioceptive information is essential for neuromuscular control. With wrist ligament injuries, in addition to mechanical deficit, there is a decreased input from mechanoreceptors, which affects the sensory motor contribution to the dynamic stability of the joint. Here, a ball in a cup is used by placing the ball in the cup and rolling the ball around the bottom of the cup using a circumduction movement of the wrist with the elbow supported on a table. This could be progressed by using a heavier ball. Another exercise using a power ball gyroscope, holding the power ball in the injured hand and circumducting the wrist. The inner ball of the gyroscope causes resistance, strengthening the muscles of the forearm and hand. Lenetsky, Harris and Brugli recognised the importance of core strength in boxing with focus on lumbar stability, as this enforces the transmission of ground reaction force through the lower body into the upper body and making contact with the opponent. They also state that rotation of the trunk is one of the 3 most important contributing factors to punching force. Each exercise should be done for 8 to 10 repetitions of 3 sets. Starting with crunches, the client should be focused on engaging their core, keeping their hands on their head and keeping their feet firmly on the floor. For lumbar extensions, they should be ensuring that their legs do not lift when the back is in full extension and their arms are held above their head. For Russian twists, they should ensure that their feet stay firmly on the floor and that they are leant back to around 45 degrees with their core engaged. For side planks, they should ensure that their elbows directly under the opposite shoulder with their hips pressed forwards and head and body in a neutral alignment. Their plank can be held for 30 seconds for 3 sets. Radok et al. Explains that the momentum in the punching arm is one of the three most important contributing factors to an effective punch. Also, that the most obvious way to increase momentum of punching is to increase the mass of the arm. 8 to 10 repetitions of 3 sets of each of these exercises can be used. Lateral raises are done by keeping the back straight, either sitting or standing, with a straight arm lifted laterally to 90 degrees without using momentum and then slowly lowered back down to the side. Overhead press is done either sitting or standing with a dumbbell held at shoulder height and then pushed vertically above the head until the arm is straight and then slowly lowered back to the shoulder. Internal and external rotations are done using a held dumbbell with the elbow into the hip at 90 degrees of flexion. The shoulder is then internally and externally rotated towards and away from the body. Tricep extensions are done with a dumbbell held in hand with the elbow bent with the hand behind the head, and the arm is then fully extended and then lowered back behind the head. Radok and Hemberg explain that glute strength has an important contribution to hip extension and rotation, which is needed during running and jumping and also punching, with the glutes having the potential to be the largest contributor to hip extension and rotation. However, they are commonly underactive in boxers. Starting with some glute activation, clams, keeping the hip stacked and core engaged, ensuring the knees abduct to full range of motion and keeping the feet stacked on top of each other. Donkey kicks, engaging the core, keeping the legs at 90 degrees and not allowing the hips to tilt. Single leg glute bridges with full extension of the hips, keeping the knees at 90 degrees and the leg raised should also be kept at 90 degrees. Glute should be squeezed at the end of range. And then single leg deadlifts, standing on one leg with the knee slightly bent. Core should stay engaged and ensure that hips are not tilted. For leg strength, squats can be used with feet and knees at shoulder width apart and a hip hinge with the back remaining flat and upright. Split squat should be used with the knee at a right angle in full squat and back kept flat with head neutral. Leg extensions should be done sat down. The knee can be fully extended to the full range of motion and then slowly relaxed. Stiff leg deadlifts should be done with feet stood up shoulder width apart with the knees slightly bent and hips hinging back with a flat back until the hands meet the mid shins. Each exercise should be done for 8 to 10 repetitions for 3 sets. Strength and range of motion of the injured wrist can be tested using hand grip dynamometry and a gynecometer to decide if the injury is ready to progress to the next stage of rehab. For hand grip dynamometry, the client will start with their arm vertically above their head. They will then squeeze the dynamometer and bring their arm straight down to their side. The force will then be represented in newtons. A 20% difference between hands is seen to show a pathology in the weaker wrist according to Gatt, Smithmore, Steggles and Loosemore. Therefore, to progress to the late stage, there is likely to be a 20% difference. However, to progress to the pre-discharge stage, there should be no more than a 15% difference. For wrist range of motion, the client's arm will be placed comfortably on a table or couch, and for both flexion and extension, the center of the gynecometer will be placed on the trochanteric bone of the wrist, and the stationary arm of the gynecometer will follow along the arm in line with the medial epicondyle. Once the wrist is in flexion or extension, the movable arm should follow the line of the fifth metacarpal. Newman states that full wrist flexion without a pathology ranges between 70 and 85 degrees, and extension should range between 60 and 75 degrees. The same difference in percentages from strength should be used for range of motion to progress between stages. The strength and range of motion difference between wrists can be calculated by taking the force of the injured wrist and dividing it by the uninjured wrist's force, then multiplying that by 100. For the late stage of rehabilitation, also known as the remodeling phase of ligament healing, Dubin et al. Describes this stage from beginning from day 15 post-injury until around day 28. This stage entails new collagen fibres aligning themselves longitudinally and cross-linking. By the 3-week point, collagen maturation continues and the ligament may regain around 60% strength. As a result, at the 3-month point, the ligament should have regained its full pre-injured strength. Therefore, this stage is full weight bearing and use of the injured wrist with focus on regaining strength and power of absolute strength, beginning basic plyometrics and continuing to build on proprioception of the wrist along with cardiovascular development. To increase wrist strength and stability in the surrounding muscles of the wrist, some simple wrist range of motion exercises can be performed using a light dumbbell or hammer. 3 to 8 repetitions for 3 sets should be used. First, wrist flexion, holding the dumbbell, fully flex the wrist and then lower back to a neutral position. For wrist extension, hold the dumbbell and fully extend the wrist and then return back to a neutral position. And for wrist pronation and supination, ideally using a hammer, hold the handle and pronate and supinate the wrist. These can all be regressed by using resistance bands instead of weights. To further develop core strength and stability, anti-flexion, extension, rotation and side flexion exercises should be used for 8 to 10 repetitions for 3 sets. Anti-flexion exercises such as dead bugs can be used with the client laying supine with their knees bent at 90 degrees and arms raised horizontally. Lower the opposite leg to arm out straight and then alternate this with the other arm and leg. This can be progressed by using a dumbbell or ankle weight. Ab wheel rollouts can also be used using the barbell. Assume a press-up position and then extend at the shoulders until there is tension from the back and arms and then bring the bar back to the original position. This can be regressed by using the rollout wheel and only performing the concentric phase, or progressed by using the rollout wheel and performing both concentric and eccentric phases. Extension exercises such as back extensions can be used either using a plyo box or a back extension machine. Lay or lean forward so the torso is off the end of the machine and then raise the torso to full back extension, then lower. This can be regressed by performing laid back extensions or progressed by holding a weight. Rack pulls can also be used standing in an athletic position with a barbell laid on top of the safety rack on a squat rack. Lift the bar and extend at the hips until stood up straight and then lower again. Progress by adding weight to the bar. Anti-rotation exercises such as bird dogs can be used. Assume a null forward position, alternate the opposite arm to leg out straight, ensuring the hips do not tilt, and then return to the original position. This can be regressed by lifting one arm and one leg at a time, or progressed by lifting the same arm and leg on the same side. Pull-off press can also be used by standing, holding the handle attachment on a cable machine. From around 45 degrees of core rotation, rotate to a neutral core position and then hold while pulling and pushing the handle. This can be regressed by using resistance bands or progressed by increasing the weight of the machine. Anti-side flexion exercises such as suitcase carry can be used by holding a dumbbell in one hand and walking for around 10 steps without compensating with the lean and then rest and repeat. This can be regressed by using a lighter weight and progressed by adding step. Side planks can also be used by balancing on a bent elbow on the floor and the side of the bottom foot. Press the hips up forwards so the body is in a neutral alignment and hold. This should be held for around 30 seconds and can be progressed with more time or regressed by bending the legs and leaning on the lower leg and knee. To further develop strength, power and stability in the arms, horizontal and vertical push and pull exercises can be used for 8 to 10 repetitions for 3 sets. Starting with horizontal push, bench press can be performed with the client laid supine on the bench, barbell in hand, lowering the bar towards the chest and then pressing back up to full arm extension. This can be regressed by using resistance bands in place of the barbell, or progressed by doing single arm chest press. Onto press ups, assuming the press up position, bend at the arms, lower the body down to the floor in neutral position, then raise back up with straight arms. This can be regressed by performing on the knees or progressed by lifting one leg on the floor. Over to vertical push exercises like overhead press, stood with feet at shoulder width apart and the barbell is held at the chest and elbows bent tucked in. Press the bar overhead and then slowly lower back to the chest. This can be regressed by performing with resistance band sat down or progressed by doing a single arm overhead press. Onto skull crushers, holding the dumbbell with both hands behind the head, lift the dumbbell overhead and then slowly lower back down to behind. This can be regressed by using resistance bands overhead or progressed by using single arm tricep extensions. For horizontal pulling, pull-ups can be used by hanging on a bar with hands at shoulder width apart, pulling the body using arm strength at the elbows until the client's eyes meet the bar that they are hanging on. This can be regressed by using resistance bands or progressed by adding weights such as a weighted belt or vest. Finally, dumbbell curls can also be used, holding the dumbbells in each hand, lifting using elbow flexion and then slowly lowering back down to hip height. This can be regressed by using a barbell bilaterally or progressed by increasing the weight. Finally, vertical pulling exercises such as bent over rows can be used, holding the bar in both hands in an athletic position with a hip hinge so that your hips are around 95 degrees. Pull the bar towards the chest and then slowly lower back down. This can be regressed by using resistance bands or progressed by doing single armed rows. Finally, face pulls can also be used by standing in an athletic position, holding the rope attachment on a cable machine, pulling the center of the rope towards the face until the elbows pass the head and then return back to straight arms. This can be regressed using resistance bands or progressed using increased weight. To further develop leg strength and stability, push and pull exercises can be used, such as squats for push. With feet at shoulder width apart and a barbell held behind the head, lower the pelvis towards the floor within the hips full range of flexion. To regress, this can be done without weight, and to progress, this can be done in the form of a pistol squat. Bulgarians can also be used stood in a lunge shape with back foot elevated, lunge down until the knee is just above the floor and then press back up to straight legs. To regress this, normal lunges can be used, and to progress, weight can be held on in one hand, add instability. For pull exercises such as deadlifts, legs should be at shoulder width apart, bar held in hand at mid shins, and then using a hip hinge to extend and flex at the hips, elevating the torso and pulling the bar back up to the thighs. To regress, stiff leg deadlifts can be used, and to progress, weights can be added to the barbell or done as a single leg deadlift. Nordic curls can also be used by the lower legs being stabilized by a partner, kneeling with the arms out straight to cushion the fall. The client will lean forward until they cannot hold the weight of their torso, keeping the hips pressed forwards and their arm, using their arms to push them back up. This can be regressed by doing hamstring curls or progressed by performing the lowering and elevation without assistance. Booth and Orr describe plyometric training as explosive bodyweight exercises focused on exploiting the additional force output of the stretch reflex of a muscle to increase speed and power. They then further explain plyometric training is used by many sports and varies depending on the needs of the sport. Therefore, these plyometrics will be an aid of quick feet movement as well as speed and agility for boxing. Starting with pogos, with straight legs, hands on hip, using the plantar flexion movement of the ankle repeatedly, jumping for 30 seconds. Squat jumps, starting with feet at shoulder width apart, squat down to a deep squat, and then during the eccentric phase, push through the knees and jump and land, and then immediately repeat for 30 seconds at a time. For plyometric push-ups, with the form of a normal push-up, on the concentric phase of the push-up, forcefully jump the hands off the floor and then slowly lower, returning to the original position. Repeat 8 times. Finally, med ball punch throws, stood with med ball in one hand at the shoulder, throw with the shoulder pass motion, however executing the rotation of the core. Then return, when the ball is returned, repeat this, 4 throws for each side. For more advanced proprioception in this stage, more weight-bearing exercises should be used, such as plank on a ball. This is done by performing a straight arm plank on a ball and keeping the head and back in a neutral alignment. A coaching point here would be to lower the hips to allow the body to regain its neutral alignment. A progression for this exercise would be lifting one leg to make the base unstable. Another exercise is a barbell farmer carry. By holding the barbell in one hand and bracing the core to keep the upper body stable, walk with the barbell parallel to the floor. Here the core should have been braced more to keep the body and shoulders upright and neutral. A progression for this would be someone tapping each end of the bar to cause more instability. The final stage of rehabilitation is preparing the athlete for game and performance. According to Dubin et al., this would be 3 months post-injury, as this is when the ligament should have regained pre-injury strength. Joyce and Loudon explain this stage represents skill development in preparation for game and/or competition. This stage is further described as a less structured, underdeveloped plan to prepare the athlete for high-intensity competitive training in games. Therefore, in this phase, the focus is on continuing development of cardiovascular fitness and strength. However, also being developed is speed and agility using sport-specific drills as well as developing plyometrics. Jeffries explains that the ramp warm-up structure maximizes sports performance in the short term as well as give a sequence to optimize each activity. The sequence activity is optimized in a manner which is considered efficient in time and energy expenditure. Starting off with raise to enhance performance with optimal body temperature, we had high knees. This would ideally be performed around a boxing gym, followed by heel flicks, making sure that you place your hands across your bottom and kick your hands. Moving on then to side steps, ensuring that these are performed without the athlete clicking their heels. And then moving on to activate. This aim is to mobilize and increase range of motion. Each activity is important to specific muscle groups. We started off with some squats and then moved on to lunges and then to hip thrusts, and then we will move on to downward dogs. Ensuring that the legs stay straight in this and that they push through their shoulders. To mobilize, This mobilises the joints that are specific for movements in the sport. We started with some press-ups and then moved on to threading the needle. We will then move on to some donkey kicks and calf pumps. For each exercise, around 8 to 10 reps should be performed for a single set. These are calf pumps. Finally, for potentiate is used to prepare the athlete for high intensity activity. So these are short and fast, starting with pogos and then anklings, and then finally some med ball slams. For advanced plyometrics, 8 to 10 repetitions for 3 sets of each exercise can be used, starting with half kneeling side toss with the partner using medicine ball. The client will kneel on one knee and throw and catch the ball using the side toss throw. This can be progressed by kneeling on one knee or regressed by standing. Depth push-ups in the press-up position with hands on weighted plates, lower the body to the floor and then explosively push up to the start position. This can be regressed by using normal plyometric push-ups or progressed by using more weight plates for an increased depth. Next is box jumps using the counter movement arm swing and hip hinge. The client will jump onto the box and then step down and repeat this. To progress this, height can be increased, or to regress this, the client can step off the box, just practicing the landing part of a jump. Finally, land pause broad jumps can be used, first stepping off the box, then landing and immediately performing a long broad jump, jumping forwards, landing with the feet at shoulder width apart in an athletic position. This can be regressed by just performing the step and land with a rebound jump, or progressed by landing on one leg. Hukkinen and Häkkinen state that reaction speed and punch force are two of the most important qualities in boxing. As the faster a boxer is able to react to the movement of their opponent, the more likely they are to be successful in aspects of their own performance. The following drills can be used to train and increase speed in aid of punch speed and footwork. Starting with weighted shadow boxing, using light 1 kg dumbbells, the client can practice punches such as jabs, hooks and uppercuts while holding the weights to add resistance. This can then be progressed by increasing the weight and should be used in intervals of 30 seconds. Next is 10-meter sprint. Using cones to mark out the start and finish, the client will be asked to sprint to the other cone and stop in an athletic position. This can be performed 3 times. Next, banded side steps can be used with a resistance band around the knees. Fast side steps can be used for lateral speed and footwork and progressed by using a stronger resistance band. Finally, isometric punch holds, using a pad ideally and boxing gloves if needed. The client will be asked to punch the pad and then hold the end of the punch for 5 seconds on the pad. This can be done 8 to 10 times for 3 sets. Walker et al. Explains that recently agility training has been given more importance in combat sports, especially in light of improving foot speed and agility, as this has shown to improve athletes' overall performance as well as their cognitive performance. The following drills can be used in aid of footwork agility in boxing. Alley shuffles. Similarly to hopscotch, jump the feet in and out of each ladder gap. This can be progressed by adding a ball catch from the side and throw. The next drill is lateral shuffles, alternatively hopping the feet in and out of the ladder holes while jumping laterally. This could be progressed by incorporating a ball catch and throw from the side as well. According to Del Vecchio, amateur boxing matches consist of 3 rounds. This, however, is broken up into 2 rounds lasting 3 minutes and the 3rd round lasting 4 minutes. Therefore, by the end of rehabilitation, the athlete should be progressing using shadow boxing with and without weights, then on to pad work, continued by using a boxing bag, and then finally sparring with an opponent. Each progression should start with a 30-second round and a 1-minute rest for 3 rounds, then increase the length of the round depending on the fatigue of the athlete. Therefore, each intervention should be progressed when the athlete is able to complete 3 3-minute rounds with minimal fatigue and no concern for the previous injury, working towards a full 3 to 4 minute working interval for each progression.